Leptospirosis is a bacterial infection that affects both humans and animals. It is caused by the Leptospira bacteria, which are spiral-shaped and thrive in warm, moist environments. This condition is considered a zoonotic disease, meaning it can be transmitted from animals to humans. It's primarily spread through contact with water or soil contaminated by the urine of infected animals, which can include rodents, livestock, and pets. The Leptospira bacteria enter the body through cuts or abrasions on the skin, or through the mucous membranes of the eyes, nose, or mouth. Once inside, these bacteria can spread through the bloodstream and affect various organs. The severity of the infection can range from a mild flu-like illness to a more severe form that can cause organ damage and even death if left untreated. The more severe form is sometimes called Weil's disease, named after the German physician who first described it in the 1880s. Leptospirosis affects an estimated 1 million people worldwide annually, resulting in about 60,000 deaths. It's considered an occupational hazard for people who work with animals or outdoors in wet environments, such as farmers, veterinarians, and sewage workers. Types of leptospirosis. Leptospirosis can be classified into two main types: enteric leptospirosis and icteric leptospirosis, also known as Weil's disease. Enteric leptospirosis represents the milder, more common form, accounting for about 90 to 95% of cases. This version typically presents as a flu-like illness without jaundice, or yellowing of the skin and eyes. Most people with this form recover completely, sometimes without ever knowing they had leptospirosis specifically. Icteric leptospirosis, also known as Weil's disease, is the severe form that occurs in 5 to 10% of infected individuals. This version involves multiple organ systems, particularly the liver, kidneys, and brain, often accompanied by jaundice. It carries a significantly higher mortality rate of 5 to 15%, compared to less than 1% for the milder form. Symptoms of leptospirosis. Leptospirosis typically progresses through two distinct phases. The first phase, known as the septicemic phase, begins after the incubation period and lasts about 3 to 7 days. This initial phase starts suddenly with fever, often reaching 38.9 to 40 degrees Celsius. Muscle pain represents another hallmark symptom, classically affecting the calf and lower back muscles so severely that many patients describe it as the worst muscle pain they've ever experienced. Other common symptoms during this first phase include chills, fatigue, nausea, vomiting, and a distinctive eye symptom called conjunctival suffusion, where the whites of the eyes appear reddened without actual discharge. Some patients develop a skin rash, which is typically transient and can appear anywhere on the body, but most commonly affects the shins. This phase corresponds to the presence of bacteria in the bloodstream and cerebrospinal fluid. After the first phase, some patients experience a brief period of improvement, lasting 1 to 3 days, before entering the second phase of the illness, also called the leptospiruric phase. Symptoms may return during this phase, sometimes with different manifestations depending on which organs are affected. In mild cases, the second phase may involve only the return of fever and general symptoms. In more severe cases, various organ systems can become involved. Liver involvement appears as jaundice, with yellowing of the skin and eyes, along with abdominal pain in the right upper quadrant. Kidney involvement leads to reduced urine output, and laboratory tests show elevated levels of waste products like creatinine in the blood. Neurological symptoms range from severe headache and neck stiffness, suggesting meningitis, to altered mental status, seizures, or even coma in the most severe cases. Some patients develop cough, chest pain, and shortness of breath. In severe cases, pulmonary hemorrhage or bleeding into the lungs can occur, representing one of the most dangerous complications with a high mortality rate. In cases where the heart is involved, the disease can cause abnormal heart rhythms or inflammation of the heart muscle itself. Without treatment, symptoms can persist for weeks to months, though most people eventually recover completely. In severe cases involving multiple organ systems, the mortality rate can reach 10 to 15%, even with appropriate treatment. Causes of leptospirosis. The primary cause of leptospirosis is exposure to the Leptospira bacteria, which are shed in the urine of infected animals. The primary reservoirs for Leptospira are both wild and domestic animals. Rats and other rodents serve as the most important reservoirs, carrying the bacteria in their kidneys and shedding them in their urine without showing signs of illness themselves. Other important animal carriers include dogs, cattle, pigs, horses, and various wildlife species like raccoons and opossums. Humans typically become infected through contact with water, soil, or vegetation that has been contaminated with the urine of infected animals. Direct contact with infected animal urine or tissues, particularly during slaughtering or handling of animal carcasses, can also lead to infection. Unlike some infectious diseases, leptospirosis doesn't typically spread directly from person to person. The Leptospira bacteria can survive in water or moist soil for weeks to months. High-risk activities include swimming or wading in freshwater lakes, rivers, or ponds, especially after heavy rainfall or flooding. Occupations such as farming, sewage work, veterinary medicine, and animal handling also increase the risk of exposure. Once the bacteria enter the body, they rapidly spread through the bloodstream to various tissues and organs. After an incubation period of typically 7 to 14 days, the bacteria begin to cause damage both directly through their own toxic effects and indirectly by triggering inflammatory responses. Diagnosis of leptospirosis. Diagnosing leptospirosis can be challenging due to its nonspecific symptoms, which overlap with many other conditions. The diagnostic process typically begins with a thorough medical history and physical examination. Your doctor will inquire about recent activities, occupations, and any potential exposure to contaminated water or animals. Laboratory tests play a crucial role in confirming the diagnosis. These tests include blood tests to detect antibodies against Leptospira bacteria, which become detectable about a week after the onset of symptoms. The microscopic agglutination test is considered the gold standard for diagnosing leptospirosis, as it can confirm the presence of specific antibodies. Polymerase chain reaction tests can also detect bacterial DNA in blood or urine samples during the early stages of infection. Additionally, cultures of blood, urine, or cerebrospinal fluid can be performed, although they are less commonly used due to the time required for bacterial growth. Early and accurate diagnosis is essential to ensure timely treatment and prevent complications. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for leptospirosis. Treating leptospirosis involves a combination of antibiotics and supportive care to manage symptoms and prevent complications. Here are the primary treatment options available. Number 1. Antibiotics. Antibiotics form the cornerstone of leptospirosis treatment, and they are most effective when started early in the course of illness. For mild to moderate cases that don't require hospitalization, oral doxycycline at a dose of 100 milligrams twice daily for 7 days represents the first-line treatment. This antibiotic effectively kills Leptospira bacteria, while offering the convenience of oral administration. For pregnant women, children under 8 years old, and others who cannot take doxycycline, alternatives include amoxicillin and azithromycin. However, the evidence for their effectiveness is less strong. For more severe cases requiring hospitalization, intravenous antibiotics provide faster action and more reliable blood levels. Penicillin, given as 1.5 million units intravenously every 6 hours, has long been the standard treatment for severe leptospirosis. Alternatives include ceftriaxone, 1 to 2 grams once daily, which offers the advantage of once-daily dosing while maintaining similar efficacy to penicillin. Studies have shown that early antibiotic administration, ideally within the first 4 to 5 days of illness, significantly reduces the duration and severity of symptoms and decreases the risk of severe complications. Number 2. Supportive care. In addition to antibiotics, supportive care is essential to manage the symptoms and maintain overall health. This may include hydration through oral or intravenous fluids to prevent dehydration, especially in cases with severe vomiting or diarrhea. Pain relievers and fever reducers, such as acetaminophen, can also help alleviate discomfort and reduce fever. In severe cases, Hospitalization may be necessary to provide intensive care and close monitoring. Number 3. Treatment of complications. Leptospirosis can lead to various complications, including kidney failure, liver damage, and meningitis. In cases of kidney failure, dialysis may be needed to support kidney function and remove waste products from the blood. For liver damage, medications and supportive measures can help manage symptoms and promote liver recovery. If meningitis occurs, additional antibiotics may be required to target the bacteria in the cerebrospinal fluid, along with measures to reduce inflammation and intracranial pressure. Number 4. Oxygen therapy. Patients experiencing respiratory symptoms, particularly those with pulmonary hemorrhage, may require oxygen therapy or mechanical ventilation to assist with breathing. Continuous monitoring of lung function is crucial to prevent respiratory failure and ensure adequate oxygen levels. Number 5. Preventive antibiotics. Preventive antibiotic treatment may be recommended for individuals with high-risk exposures to potentially contaminated water or animals. This typically involves doxycycline, either as a single 200 milligrams dose taken within 24 to 72 hours of exposure, or as 200 milligrams weekly during periods of continued exposure risk. At the end, with appropriate antibiotics and supportive care, most patients recover completely, even from severe disease. Now, we want to hear from you. Have you or someone you know ever encountered leptospirosis? What symptoms did you notice first, and how was the recovery process? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.